Hello again. In this section, we will go over the components of a sample healthcare proxy conversation. The first part, the introduction, could be, for instance, "Good evening, I'm Dr. Grover. I work with Dr. Bresney, and she would like me to speak with you today. How are you?" Pause here to allow them to assimilate your name, the fact that you're there on behalf of their physician, and also to allow them to understand you are concerned about them. You did ask how they're doing. You could also be prepared for some information about how they're doing. But moving on, after the introductions are done and the ice is broken, the next part is to introduce the topic of the conversation. A sample block of information may go. "Dr. Bresney asked me to speak with you about some paperwork to appoint someone who can speak on your behalf if you are unable to speak with us about decisions regarding your health care." This is a paper called Healthcare Proxy. We do not have one for you. Have you heard of this? Do you have one? Now, this is a very complex introduction to the purpose of the conversation. Allow for a pause. Ask if they require you to repeat the explanation, since it doesn't just say, "I'm here to do a healthcare proxy with you." It also explains what the healthcare proxy is in about a sentence and a half. Once the introductions and the purpose of the conversation are established, you will likely move on to a more detailed explanation of who a healthcare proxy is and what kind of a person would make an ideal healthcare proxy. So, part 3 of the conversation, the explanation of a healthcare agent, could sound like this. Having someone serve as your healthcare agent and doing paperwork for this, that is a form, the healthcare proxy form, helps physicians to know who is aware of their wishes, your wishes, and who they should communicate with if you are too sick to communicate with us, and who they should inform regarding results and other ongoing matters if they are unable to speak to you and explain it to you. You could elaborate further if the opportunity presents itself. This is something that you do to plan for your health care in the future. Just like you plan for your retirement, you could plan for your health care by having someone in charge just in case. Ideally, we would like to be able to speak with you at all times, but the future could be unpredictable at times. You can pause here, having organized this somewhat simplistic explanation into a few blocks. Once the patient is comfortable, you could reiterate some important points. The two most important ones to reiterate: one, which the patient may not have thought of, is the fact that this document is valid across the continuum of care. Whether the patient is home, in a nursing home, an assisted living, or the hospital, this document is effective. The second important thing to emphasize is the patient needs to discuss their wishes and their personal preferences regarding healthcare with their agent. Pause for questions after having explained this, and also to confirm willingness to fill out the form. Subsequently, show the form to the patient and start to fill out the information on their behalf with their permission. Should the patient want to fill their form out themselves, you could facilitate that. Once the forms have been filled out, copies can be made. Please feel free to use the provided literature regarding an ideal healthcare proxy, a person who is aware of the patient's wishes, who is easily available should a healthcare professional attempt to approach them, someone who is able to get the family together and keep them informed regarding the person's or the patient's progress. This is a conversation that will probably take at least 15 minutes. Filling out the paperwork and making copies would add some additional time. Budget for plenty of time. As a healthcare professional, you are best situated to be able to discuss this with the patient. These are things which come in very handy when an elderly patient lands up in an emergency room and is intubated or in the ICU, and the family struggles to find a center point and is unable to decide what exactly the patient would have wanted or what their preferences were. Even if you fill out one healthcare proxy in your geriatric rotation, you would have achieved a great deal. Thank you for helping us improve our healthcare proxy documentation. Good luck.